I woke up one morning with a really strange pain in my leg, thought it might be a sprain. So I left it. I tried to forget about the pain. 3 days later, it got quite bad, so I decided to go to hospital, and I was very, very surprised, being in my 20s, that they diagnosed me with a deep vein thrombosis. The hospital seems like a nice place to work, and I have built up a relationship with some of the nurses there, and they tell me they like to work there. It seems like quite a nice environment.
I think actually it's very important for a nurse to talk to the patient and make them at first feel comfortable, smile at them. You know, it works wonders actually, because then they start feeling comfortable with you. I go through Reed to NHS hospitals, and depending on the patients have been given to look after, I actually first go around the patients and ask them a lot of questions, because they can actually tell you much more about their own care and what their needs are, what they expect from the care that they're getting. But as a Reed nurse, I also have to be flexible in order that I fit in with the conditions of work on the ward, or whether it's in a unit or whatever. I have to fit in as well with the regular staff, and then do my best for the patients that I've been allocated to look after.
Clearly the NHS is a massive employer. Reed provides a specialist recruitment service to the NHS, and in particular areas of expertise. We recruit nurses for the NHS, we provide a flexible workforce for periods of particular need, and we also recruit other specialists such as doctors, occupational therapists, speech and language therapists, audiologists, radiographers, and a whole range of other skilled niche areas who are needed at peak periods. So we give the NHS a degree of flexibility and more options than just a permanent workforce would provide.
I'm an occupational therapist, and patient care is of highest priority to me. When I was living in Australia last year, Reed facilitated my employment by enabling a very easy process of recruitment. They provided me with all the information that I needed to know in order to start work in the UK. I guess Reed has enabled me to do this by placing me in a position in which I feel my skills can benefit patient care. They have certainly ensured as well and made the process easier with my employers by providing them with all of the information that they require in order to assure that I'm meeting standards according to my professional regulatory bodies, or just the NHS Trust itself. And that in turn means that my patients are assured that given that I work through Reed, that they know that I'm a qualified occupational therapist and that I'm providing them with the most optimum care possible.
PASA, the NHS's purchasing and supply agency, is the customer for us, and they're very particular about what they require, and understandably so, and we work very closely with them to ensure that our candidates are compliant and that we supply people who meet the NHS's needs, and that's a long-standing, ongoing and effective relationship.
The healthcare professionals that Reed place within the NHS are vetted to the highest possible standards. Our systems are also tailored to make sure that we cannot place anyone who is not 100% compliant. It's telling that Reed are the only agency in the UK who are ISO 27001 compliant, which is the registration for data protection.
So in providing the correct candidates for the positions, they are in turn providing an extremely high level of service to patients, and that at the end of the day is very, very important to the patient, and it's security for them as well, knowing they have someone that is extremely professional.
I have worked with Reed for 10 years, and I have actually worked in several specialities, and I actually have learnt a lot of things through working in these different areas for Reed.
The thing that impresses me the most about Reed is that their dedication to, firstly, their candidates. They have worked extremely hard for me to provide me with the opportunity to work in a placement in which suits my skills. Also, they have ensured with employers that they provide suitable candidates in those positions as well.
We'd also encourage people to continue their continued professional development by helping them in any way that we can. That may be including making financial donations towards CPD. It may be running of training courses, but Reed will always encourage healthcare professionals to reach the highest possible standards attainable. Anybody looking for staff within the NHS or healthcare sectors really should look at Reed. The reasons for that are very simple. We will keep you safe. We will make sure that everybody who comes to you is 100% compliant. We will stick to our agreement as far as rates are concerned. And we are an employer with morals and integrity.
If I was to describe Reed in 3 words, I guess they would be proactive, most definitely proactive, efficient, and definitely approachable.
At Reed, we're very, very focused on people, and supplying people day in, day out to the NHS means that we're very aware of how people can make a difference. And in fact, our philosophy, our focus is very much based on the principle that people make a difference, but they make a good difference or a bad difference, and getting the right people into the right place at the right time is the most important thing for us, and that's what we're here to do.
The staff at the hospital were really friendly and nice, and they made me feel like it wasn't anything out of the ordinary.
Reed gives me job security. It gives me flexibility. I get holiday pay when I need it, and also I get all the work that I want whenever I want it. I've never been without work with Reed. Whenever I've called them, they've got something for me.